Depression is a common and serious medical illness. It affects how you feel, think, and act. Depression can lead to a variety of emotional and physical problems. It can also decrease your ability to function at work and at home. Depression is not a sign of weakness. It is a real illness with real causes. It is important to remember that depression is treatable. With the right treatment, most people with depression can get better. It's crucial to understand that sadness and depression are not the same things. Sadness is a normal human emotion that everyone experiences from time to time. It is usually triggered by a specific event such as a loss or disappointment. Depression, on the other hand, is a more persistent and pervasive feeling of sadness that can last for weeks, months, or even years. There are many different types of depression. Major depressive disorder is characterized by a persistent feeling of sadness or a loss of interest in activities you once enjoyed. Persistent depressive disorder, also known as dysthymia, is a milder but more chronic form of depression. Bipolar disorder, previously known as manic depression, is characterized by extreme mood swings that include periods of mania or highs and depression or lows. The causes of depression are complex and not fully understood. It is likely that a combination of factors contributes to the development of this illness. Some of the biological factors that may play a role include genetics, brain chemistry imbalances, and hormonal changes. Psychological factors such as negative thinking patterns, low self-esteem, and difficulty coping with stress can also contribute to depression. Social factors such as stressful life events, relationship problems, and social isolation can also trigger or worsen depression. Depression can have a profound impact on both the body and the mind. Some of the common emotional symptoms of depression include feelings of sadness, hopelessness, guilt, worthlessness, and emptiness. People with depression may also experience anxiety, irritability, anger, and restlessness. They may lose interest in activities they once enjoyed, have difficulty concentrating, and experience changes in their sleep and appetite. In addition to these emotional symptoms, depression can also manifest physically. Some common physical symptoms include fatigue, low energy levels, aches and pains, headaches, digestive problems, and changes in sleep patterns. Depression can also weaken the immune system, making individuals more susceptible to illness. While both men and women experience depression, there are some differences in how the illness manifests in each gender. Men with depression may be more likely to exhibit symptoms such as anger, irritability, substance abuse, and reckless behavior. They may also be less likely to seek help for their depression due to societal expectations and stigma surrounding men's mental health. Women, on the other hand, may be more likely to experience symptoms such as sadness, crying, feelings of worthlessness, and self-harm. One of the most concerning aspects of depression is its potential to lead to suicidal thoughts and behaviors. Depression is a major risk factor for suicide, and it is estimated that a significant proportion of people who die by suicide have a history of depression. In some cases, individuals with severe depression may experience psychotic symptoms such as hallucinations or delusions, which can further increase their risk of suicide. It is crucial to remember that depression is a treatable illness, and seeking help is essential in preventing tragic outcomes. If you or someone you know is struggling with depression, it is important to reach out for professional help immediately. Mental health professionals such as therapists, counselors, and psychiatrists can provide support, guidance, and evidence-based treatments to help manage depression and reduce the risk of suicide.